Welcome. Today we're diving into the world of paroxysmal atrial fibrillation, often called PAF. We'll unravel what this heart condition is, what causes it, how it affects the body, and what you can do about it. So, what sparks paroxysmal atrial fibrillation? The exact cause is often a complex interplay of factors. High blood pressure is a major culprit, as is underlying heart disease like coronary artery disease or heart valve problems. Lung diseases such as COPD or pulmonary embolism can also trigger PAF. Other potential triggers include excessive alcohol or caffeine consumption, stress, thyroid disorders, and even electrolyte imbalances. Sometimes, no specific cause can be identified, and we call it lone atrial fibrillation. To understand PAF, we need to look at the heart's electrical system. Normally, electrical signals originate in the sinoatrial node, or SAN node, in the right atrium. These signals spread in an organized way, causing the atria to contract efficiently, pushing blood into the ventricles. In atrial fibrillation, however, this organized process goes haywire. Rapid, chaotic electrical signals fire from multiple locations in the atria. These signals override the SAN node's control, leading to a rapid, irregular heartbeat. Because the atria are quivering or fibrillating instead of contracting properly, blood may pool in the atria, which can increase the risk of blood clot formation. These clots can then travel to the brain, causing a stroke. Atrial fibrillation is the most common type of heart arrhythmia, and paroxysmal atrial fibrillation is a specific type. Its prevalence increases with age, affecting a greater percentage of older adults. People with existing heart conditions, high blood pressure, lung disease, or other risk factors are more likely to develop PAF. Studies indicate that men are slightly more prone to developing it than women, and certain ethnic groups may also have a higher risk. The symptoms of paroxysmal atrial fibrillation can be quite varied. Some people experience noticeable heart palpitations, a racing or fluttering sensation in the chest. Others may feel short of breath, especially during exertion. Weakness, fatigue, dizziness, and lightheadedness are also common. Chest pain or discomfort can occur, but it's less frequent. Importantly, some individuals with PAF may have no noticeable symptoms at all, making diagnosis more challenging. Diagnosing paroxysmal atrial fibrillation relies on capturing the abnormal heart rhythm while it's happening. An electrocardiogram, or ECG, is the primary diagnostic tool. It records the electrical activity of the heart. Because PAF is intermittent, a standard ECG might not catch it. In these cases, longer-term monitoring is needed. This can include a Holter monitor, which is worn for 24 to 48 hours, or an event recorder, which can be worn for weeks or even months and activated when symptoms occur. An implantable loop recorder can be used for even longer-term monitoring. Additionally, blood tests may be done to rule out other conditions, such as thyroid problems. Paroxysmal atrial fibrillation is defined by its intermittent nature. Episodes of AFib start and stop on their own, usually within 7 days. If AFib persists for more than 7 days, it is defined as persistent AFib. If AFib persists for more than a year, it is defined as long-standing persistent AFib. If both the patient and the medical professional decide to stop further attempts to restore normal sinus rhythm, it is defined as permanent AFib. The goals of treatment for paroxysmal atrial fibrillation are to control the heart rate, prevent blood clots, and, if possible, restore and maintain a normal heart rhythm. Medications play a key role. Rate-controlling drugs, such as beta blockers or calcium channel blockers, help slow down the heart rate during AFib episodes. Anticoagulants, like warfarin or newer oral anticoagulants, reduce the risk of stroke by preventing blood clot formation. Rhythm control strategies include antiarrhythmic medications, which attempt to convert the heart back to a normal rhythm and maintain it. Cardioversion, either with electricity or medication, can also be used to restore normal rhythm. For some patients, catheter ablation, a procedure that destroys the areas in the heart causing the abnormal rhythms, may be recommended. Lifestyle modifications such as avoiding alcohol and caffeine, managing stress, and treating underlying conditions are also important. While preventing paroxysmal atrial fibrillation completely isn't always possible, managing risk factors can significantly reduce the likelihood of developing it. Controlling high blood pressure, maintaining a healthy weight, managing underlying heart conditions, and avoiding excessive alcohol and caffeine intake are crucial steps. Regular exercise and a healthy diet are beneficial for overall cardiovascular health. Managing stress through relaxation techniques like yoga or meditation can also be helpful. The prognosis for individuals with paroxysmal atrial fibrillation varies. For many, PAF is a manageable condition, especially with appropriate treatment and lifestyle modifications. However, untreated PAF can increase the risk of stroke, heart failure, and other complications. Recent research focuses on improving ablation techniques, developing new antiarrhythmic medications with fewer side effects, and identifying genetic factors that contribute to AFib. Studies are also exploring the role of inflammation and other emerging risk factors. One exciting area of research is personalized medicine, tailoring treatment based on an individual's specific characteristics and risk factors. This holds promise for more effective and targeted management of paroxysmal atrial fibrillation.